Welcome, everyone. We'll get started in a minute or two and let people join the call. But welcome, welcome. I feel like we need some intro music here. I'm going to get things started. We have a lot to talk about today. So good afternoon, everyone. My name is Rebecca Penn. I am the project manager for the National Safer Supply Community of Practice. And I'm really glad to have you joining us here today for our hot topic webinar, Ban on Safe Supply, an Alberta case study. I'd like to start us off by acknowledging colonialism in our past and our present. We come together in this community of practice from across Turtle Island as people who live on treaty lands and ceded and unceded territories. Our team and our members of our community of practice are comprised of individuals and organizations from across Turtle Island. We are all treaty people. We work in a sector whose goal is to address social and structural harms. We recognize that the production of these harms comes from our colonial history and its enduring practices, institutions, and ways of thinking in our ongoing daily lives. We know that Indigenous people, as well as members of the African, Caribbean, and Black communities, are disproportionately harmed and criminalized by drug policies that are rooted in racism and colonialism. Colonialism is with us today, and we commit to working in ways that transform racist and colonial institutions and practices to repair harms, prevent future harms, and to work towards a more inclusive and equitable future. So for those of you who are not familiar with the National Safer Supply Community of Practice, very quickly we'll let you know a little bit about who we are and what we do. We are funded by Health Canada's Substance Use and Addictions Program, and the Community of Practice is a collaboration between the London Intercommunity Health Centre, Canadian Association of People Who Use Drugs, Alliance for Healthier Communities, and the Ontario Aboriginal HIV/AIDS Strategy. The purpose of the Community of Practice has been to support the scale-up of prescribed safer supply programs through capacity building and knowledge exchange. And while we focus on a medicalized model, we also recognize the important role of non-medical approaches to safer supply. We support advocacy for a wide range of options for supporting people who use drugs that include both medical and non-medical approaches and decriminalization. I encourage you to have a look at our website where you'll find the wide range of resources that we have. And you'll find our past webinar, videos of our past webinars there, a very large resource library of materials relating to harm reduction and other topics related to substance use health care. You'll also find protocols, guidance documents, key messages, and then very important for you to know, we have an evidence brief on our website where you can see what research is currently being published, what's being said about safer supply programs right now. We will be recording this event and we will be posting it on our website where we'll be reviewing it first and then putting it up. If you have any technical difficulties, your best bet is actually to simply log out and rejoin. That often takes care of the problems. There is closed captioning available in English. You can find that on the Zoom toolbar. There's a little button for closed captioning. You'll also find in the Zoom toolbar the chat box and the Q&A box, see the buttons for those. We encourage you to put any questions that you have for our presenters into the Q&A box. And if you have any chat that you'd like to go to all of the people on the call, then you can put that in the chat box there. After the presentation from Patty and Kate, we'll be doing a really quick poll, and it's really helpful for us if you can answer that poll for us. It helps with our stats for our funder and helps give us information about what's useful for you. And a couple of other quick notes. We've got another webinar coming up on February 29th. It's our another hot topic webinar on the ethics of prescribed safer supply. We'll have Dr. Adrian Gouda, Dr. Daniel Buckman, and Dr. Alice Varani speaking to this. So I encourage you to sign up for that webinar. And another thing coming up. Oops, sorry about that. I hit the wrong button somehow. There we go. So another thing coming up in March 21st. This is more of a save a date announcement. The National Safer Supply Community Practice funding ends on March 31st, and so to celebrate the work that our community has done together, we'd like to have a gathering of sorts, a virtual gathering, bringing the community and all of our memberships together to celebrate the work, the relationships that have been created over the past 3 years. So please sign up for this. It should be a really a great event. And again, I encourage you to check out our website for more information. Thank you very much. And with that, I'm really delighted to turn it over to Kate and Patty. I'll let you both introduce yourself and get us started with a great and important conversation today. Thank you both.
Okay, thanks so much for having us. Hopefully our slides are showing up here okay. So I'm Kate Klitza. I'm a physician in general internal medicine and addiction medicine, working here in Calgary.
And yeah, I'm Patty Wilson. I'm a nurse practitioner also here in Calgary.
So we want to start with our own land acknowledgement for where we are today. We'd like to both acknowledge and pay tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. As well, the city of Calgary is also home to the Métis Nation of Alberta Districts 5 and 6. We're both members of this National Safer Supply Community of Practice and are really grateful for what the Community of Practice has done. I also work for a consult service that is funded by a provincial government grant. So we wanted to set the scene here as we talk about the safe supply ban in Alberta. As you'll hear, this is something that has been in place for roughly a year now, but still very much something talked about. So this is a quote from our current Minister of Mental Health and Addictions, Dan Williams, just from January 17th. Where he goes on to say, you know, our government was explicit when we made any so-called safe supply program illegal in Alberta, ensuring these failed, dangerous policies do not have a place in our province. Supplying high-powered drugs to people suffering from addiction will only make matters worse. So still acknowledging that their intention was to make safe supply illegal. We're going to share some things today that can be upsetting to some viewers or some of the audience. We're sharing a lot of direct quotes from folks who participated in the Special Select Committee to examine safe supply, which you'll hear a lot about today. These quotes don't at all reflect our opinions, but are an important part of the narrative and the narrative that contributed to where we are today. So, you know, I know this is on webinar mode, but if you have to take a break, leave, please do what you need to do to stay safe and comfortable. We're going to start with a background on prescribed safe supply here in Alberta. We're going to talk about the Narcotic Transition Services. And then we're going to go on to understand how the role of this committee to examine safe supply contributed to some of these outcomes through a narrative policy framework. And we'll talk a little bit about where we are today.
All right. So next slide. So to begin with, I think it's important to understand that safer supply in Alberta has never been an accepted or welcome intervention by our current government. This is a quote from then Premier Jason Kenney back in October of 2020. We don't believe giving people coping with addictions free drugs is a solution to the problem of drug addiction. And when we're thinking about SUAP-funded programs specifically, people may not be aware, but there actually are no programs within Alberta, but that's not for lack of trying. This article published in the Globe and Mail in 2021, there's this quote here. So staffers from the province's Ministry of Mental Health and Addictions pressured groups to withdraw, their application. So the SUAP application, according to two people with direct knowledge of the dealings. So it's not as if there weren't efforts to actually get safer supply programs within Alberta, but there was no support and in fact direct opposition from this current government. That doesn't mean that there weren't safer supply prescribing going on within the province of Alberta. As we can see in our province, there are the IOT sites, the injectable opiate agonist treatment, as well as one little site there that was captured within this national survey of at least one site doing risk mitigation prescribing. And then this quote that is in this study as well, again, we don't know if this is referencing Alberta specifically or globally capturing the phenomenon. We are aware of safer supply prescribers who did not participate related to fear of retribution from colleagues, regulatory bodies, and or regional governments, specifically related to trying to recruit members to participate in their study.
So we want to, again, give a little bit of background on what we're talking about here when we talk about a ban on safe supply. So safe supply in the province, as you'll hear, is not explicitly banned, but it became extremely difficult to access, very restricted, and with a goal of getting folks off of safe supply onto other medications. So this all came through what you'll hear us refer to as NTS, or the Narcotic Transition Services. So in October of 2022, new standards for these Narcotic Transition Services were announced through an amendment to our current Mental Health Services Protection Regulation. So there was an amendment within this regulation. This is law. This regulates how we are allowed to practice medicine in the province. And we were given until March 2023, essentially to move people over to OAT, so Cadian, methadone, Suboxone, or they had to be part of the NTS clinics. This regulation impacted both inpatient and outpatient care and was developed with very little input from experts. And at the time, for a lot of us, seemed like it kind of came out of the blue, which is not the case, but that's a little bit how it felt. So within this regulation, safe supply can only be prescribed at designated NTS, or Narcotic Transition Services clinics. At the time that this came into effect, there were 2 clinics in the province, so one in Calgary, one in Edmonton, so already very restricted. Safe supply has to be dispensed at these clinics, so can't be accessed at other pharmacies, and all doses had to be witnessed, again, only within these clinics. So any administration of a high potency opioid for opioid addiction must happen at the location of a licensed AHS clinic and will be supervised by an authorized, regulated health professional to protect against diversion. And there is part of the sort of underlying motivation for a lot of these changes was, again, this fear of diversion, and we'll talk a little bit more about those narratives. So really, the goal was to restrict access and transition people off of safe supply. So services focused on stabilizing, tapering, and transitioning patients under expert medical supervision to evidence-based opiate agonist therapy from, again, quote, high potency opioid narcotics, which is a red flag in and of itself.
So that happened in October 2022. If we go back a bit further to December 2021, we had the Special Select Committee to examine safe supply. And this committee was struck with the goal to examine the concept of safe supply. It It met between January and March of 2022. And with the final report issued in June of 2022. And then, of course, we hear the announcement that Safer Supply would be banned in October of 2022. This is then Minister of Mental Health and Addictions, Mike Ellis, the day it was announced, saying that as a former law enforcement officer, I want to look at objective evidence, meaning regarding Safe Supply. However, in the question period, Ellis referred to Safe Supply as taxpayer-funded supply of drugs. Important to know about the committee that after I believe it was the second meeting, that after reviewing the list of invited guest experts, this initially started out as an MLA committee comprised of UCP and NDP MLAs, but after seeing the invited list of guest experts, the NDP walked away saying that this was a rigged committee. So the mandate of this committee was to examine the concept of safe supply. Now, those quotations were included in that mandate. Those quotations around the word safe supply, whether safe supply would impact overdoses, diversion, or health, whether safe supply would increase risks, and examine the history of overprescribing of opioids, and whether safe supply would have any benefit or risk. So that was the mandate of this committee. And starting to move a little bit into the framework that we used to look through these transcripts. There are a lot of common assumptions or themes that were underpinning a lot of the presentations of the invited guest speakers. And we're going to highlight some of them as we move through the committee specifically. But I wanted to start out by talking about one very common one, and that was this idea of addiction as a brain disease came through over and over and over again. And this quote by Nathaniel Day, who is the current medical director of addiction, mental health, and correctional services for Alberta Health Services, illustrates this. Here he is describing, how someone's brain reacts to receiving opioids, apart from Suboxone. So, quote, then we move on to smoking or injecting. We discovered that our old drug of choice is best replaced by the most powerful drug we can find. Every time we step up our game, our brain reacts. So again, we can see how this is describing sort of a disease process that happens when someone's brain is exposed to opioids. Again, as per Nathaniel Day.
So as Patty already mentioned, this committee was struck and immediately there was concern from community across the country about what was happening here. The BC Centre on Substance Use wrote a letter outlining some concerns. They were concerned that this committee didn't engage with individuals who were actually evaluating safe supply interventions, didn't involve people with lived and living experience, addiction medicine specialists, families impacted by substance use, researchers, and public health experts, and right off the bat had an over-reliance on submissions from individuals with a history of being critical of safer supply. So these concerns were shared with the committee and the BCCSU declined to participate. There was another letter that came out with a group of over 50 research scientists and clinicians, again expressing concern. This included concerns from across the country, regarding a report that was commissioned by the Alberta Ministry of Health for this committee. The report was of critically low quality. As you can see here, conclusions were not based on evidence, didn't accurately describe safer supply interventions, didn't talk about the range of clinical opinion and associated ethical issues, didn't portray the preferences of people who use drugs accurately, mischaracterized research expertise, misrepresented the range of recommendations made by people who were evaluating programs, went outside of their scope to make other recommendations, and did not properly analyze cost or cost effectiveness. As was mentioned, all the NDP committee members resigned. They were concerned that the speaker list only included people previously opposed to safe supply, and two prominent groups, harm reduction groups within the province, also withdrew. Again, with concerns that this effort had a predetermined outcome. So an open letter from Moms Stop the Harm, and each and every said that they were withdrawing from this process because, again, the presenters selected by the UCP members appeared to have been handpicked for their stances against safe supply.
So I wanted to take a second to explain why we chose the narrative policy framework as a means to examine the transcripts from this committee. This is a framework that is grounded in storytelling and sort of examining the storytelling that takes place. And within storytelling, there is very clearly sort of right and wrong behavior from a policy related behavior. So whether to pass a policy or not pass a policy, and whether that is the right or wrong decision. And because there is a moral center within this, there's at least one character. So whether there's a victim, a villain, or a hero. And because storytelling is the main focus of this framework, it looks at how stories are constructed using both emotions as well as evidence, sometimes more emotions than evidence. And the reason this framework seemed the most appropriate in this circumstance, and generally in harm reduction work, is that if you've ever been sort of frustrated by policies and not understood why some policies are passed, especially if they're not based in evidence, this is a powerful policy framework to use to understand how it all sort of links together and how it makes sense, again, not from an evidence perspective, but from a storytelling perspective, why this actually makes, again, not logical sense per se, but storytelling and narrative sense. And so how we used this framework to look through these transcripts, well, not just transcripts, but also the final report that was commissioned by this committee, by the announcements related to this policy, and then also the actual acts and regulations related to this regulation change as well. All right, and so let's look into what we actually found. Within this policy framework, we looked at these 4 different types of characters that came through. We'll go through them step by step. The first one to help, the first one we're going to cover are villains. So villains are characters within this framework, and what they do is they cause harm. Specifically, they will cause harm to victims. And so we wanted to look at how are these villains actually harming people within the way that these guest speakers, or with how the MLAs are describing their actions. And so the people within the committee that were described as causing harm were people within the safe supply programs, the pharmaceutical industry, and physicians. And so pharmaceutical companies or industry were framed as being responsible for the history of overprescribing opioids through undue influence on medical education. And this is an influence that continues today via safe supply. And so this quote is from the final report. We heard explicitly from Dr. Tange that in the 1990s and 2000s, a lot of education that took place by the pharmaceutical industry was geared toward physicians. This is a practice that continues to happen today. And then from Kevin Sabat, we are dealing with multinational corporations that have intense lobbying capability. Even if you try to write them out of the law, they find ways into it. And then the other villains that were described, again, from this committee's work, were people receiving prescribed safe supply. They were almost always framed as intending to divert their safe supply, which was framed as being harmful always. Diversion was always framed as being a harmful practice. So this is from Earl Thiessen. In my opinion, nothing is stopping an addict from getting their free drugs and trading them to their dealer for their drug of choice. And then from Lynette Reeve, he made $1 million this year from buying up safe supply off the street from people who had to dispense of them, and he sold it across Canada. Sharon Koivu, many acknowledge that they were motivated by the income associated with diversion. And then from Gerald Posner, they'll sell what they already got as their government supply to somebody else, so it filters out into the community. And then the last sort of key villain that was described are doctors who prescribe opioids. They were either framed as unintentionally causing harm by prescribing opioids for chronic pain, or causing harm intentionally by prescribing safer supply now. So again, from Gerald Posner, you had doctors who, in some cases, were overprescribing. You had some who were running illegal pill mills. Kevin Sabat, again, partially responsible for the problem we have now because they were incentivized to prescribe. Lynette Reeb, so doctors playing a role in one of the waves of the crisis with no upper limits to prescribing, guided by patients' pain experience and sympathy. Earl Thiessen, my final point, if we seek harsher penalties for drug dealers that sell fentanyl causing overdose deaths, will we hold the prescribers of so-called safe supply accountable to the same standards?
So again, this is sort of, you know, using this policy framework to understand how we actually got to where we are today in the province with the Narcotic Transition Services, with the regulation changes to the mental health regulation. So we've heard about, you know, within this narrative that was being told, you know, kind of all the way along, we've heard about who the villains were seen to be. Now, if we look at who the UCP described as victims, it's, you know, people with addiction and communities were the themes that came out. So the victims being Alberta communities, again, sharing quotes from members of this committee, uninvited speakers. So from Sharon Koivu, community safety may be compromised as people seek ways to pay for diverted drugs. The flooding of prescription opioids onto the streets started this crisis. One of the recommendations from their final report that the government take the necessary steps to protect the public from the provision of harmful pharmaceutical practices. And then from Amber Fort, I question what message our youth will pick up from legalizing and normalizing opioid use. So again, safe supply in this narrative is putting communities at risk. Similarly, putting people with addiction at risk. So from Nikki Matthew, she said that she would have started on Suboxone earlier if safe supply wasn't available. Of course, I'm interested in safe supply, and I asked him a little bit about how he felt being on the program, which distributes him high doses of hydromorphone and I feel enables addiction. He said that he hated it. He wanted to be done with addiction, and he wanted recovery from Jeremy Devine. And then finally from Marie Durnan. But the irony is that these people who are in recovery have to keep quiet. You're not hearing from them. They are in fear of being censured. So, you know, a lot of this absolutely does not reflect the actual sort of experiences many of us have had, and most of these are sort of one-off anecdotes. Next, we have heroes identified in this narrative. Not surprisingly, the UCP has identified themselves and the Alberta government as the hero here. Again, a few quotes from this report. The first is actually from the announcement where they announced the new regulation changes. So Alberta is the first province in Canada to protect communities from the diversion of high-risk opioids while increasing access to specialized care for people with severe opioid addiction. From Earl Thiessen, the whole recovery-oriented system of care has done a 360, an actual investment in improving people and recovering lives by the Alberta government. And then from one of the MLAs, MLA Yao, our current government is doing a fantastic job of allocating all our resources and finances to addiction services, adding beds and whatnot.
So we added this this last part as well, this last character, a shadow character. So shadow characters, they play roles that are not directly named, but still move a plot forward. And they can fall into villains, victims, or heroes as well. So they can play the same role. And so one that came through very loud and clear was, as a villain, was actually Safe Supply as well. And Safe Supply was characterized, clearly as the villain, and it came through a few different ways under these sort of sub-themes. And so we've outlined here how Safe Supply was personified and how it helped sort of, like I say helped, but like it did help in terms of helping them pass this policy, move these themes forward. So safe supply and the brain disease of addiction became like linked together very, very quickly. And so once these two became synonymous, the way it was spoken about changed as well. So if we think of safe supply and addiction being the same thing, which again, many of the guest speakers absolutely link them together, safe supply, it removes the capacity of someone's ability to choose. And this is exemplified in this quote by Gerald Posner. So safe supply takes away the impetus to go to recovery, because what it does is it keeps the addiction going. It lets the addiction flourish. Safe supply also causes people to commit crime. This was shown in part by this quote by MLA Amory. This was a series of questions put forward to the chief of police, who was asked to come, and it was a bunch of questions asking sort of different ways over and over again, will safe supply increase crime in the community? So this question I'll read, do you foresee a safe supply model which increases the amount of prescription opioids being distributed to individuals as an invitation to cartels of organized crime to come here in Alberta and operate? So safe supply, because we're dealing with, like, again, a brain disease model of it, it's also very highly contagious. MLA Rosen here, clean drugs reduce the perception of harm, which increases the use of drugs, which I found to be such a profound, simple, but logical and straightforward statement. And lastly, how is this very highly contagious, disease spread? It's spread through lazy and poor practices. So from MLA Fry, I wonder how that even fits within a physician's Hippocratic oath. And that's just from, I'm not a physician at all, I'm just a politician. This next one from Anna Lemke, I view safe supply as a form of chemical abandonment of vulnerable individuals with addiction. And lastly, from Emily Rosen, but in a safe supply model, individuals could just walk out, essentially get the drugs with almost without a proper prescription or allowance. And so just to summarize, like, the role that safe supply is being put into, this problem that's being outlined is a substance is being circulated, which is safe supply. The substance is causing a disease, which is addiction. This disease removes people's ability to choose. It makes them commit crime. It's highly contagious, and it's being spread by our medical professionals. And communities are at risk of this substance flooding in and causing disease and death. And so what is the solution when all of this is going on? And before we move into what ultimately was the solution that was proposed and then, implemented, I want to take a second to step back for a second and for us to remember what was actually going on in Alberta and what the actual risk was and what was going on in communities and who was being impacted while all of this storytelling was going on. Because it was awful and tragic what was happening, and people were playing like make-believe while this was happening. So some people will be familiar with these blue bars, maybe some people won't, but this is how the deaths related to poisoning are reported in Alberta. And so those blue bars represent each month, and they represent the people who have died from poisoning in Alberta. And if we look at the arrows that we have added right now, that first arrow pointing down, that represents when the Safe Supply Committee was struck. So when they announced, hey, we want to be objective and we want to just look at the facts, but then also they're putting quotation marks around safe supply and they're calling it taxpayer-funded drugs. And then the second arrow there, the first arrow that's pointing upwards and the second arrow on the graph that's pointing up, that's when they actually announced, hey, we're going to actually put in these steps to ban safe supply, and you have 5 months to take people off or move them over to this clinic where the restrictions are very, very strict and they'll have to lose access to their primary care provider if they want to do this. And then that last arrow there is when safe supply is banned in Alberta. And if you look at all of those blue bars between when the committee was struck and then when that last arrow is on that graph, there are like There are people who are dying in each of those bars. There are families that are changed. There are communities that are changed. While people are flying into Alberta from outside of Alberta, while people in Alberta are all doing this make-believe storytelling, and it's incredibly tragic that all of this is going on. And I just think we can't, while we might while we're doing this kind of analysis, I just don't think we can ever really forget what we're talking about. And I know we're speaking to like the right crowd to like not forget that, but I also don't want to forget that even today. So what stories are they telling with all of this, with all of these different characters? This is a story of like helplessness and loss of control. It's a situation that is bad as it's always been, and we've always thought that this would be acceptable, but don't worry, someone's coming in to help save us. And that is going to be this government, because it's all out of control, but don't worry, they're going to come impose that control. So doctors are out of control, pharmaceutical companies are out of control, these drugs are flooding in, everything seems out of control, don't worry. Next slide. How do you fix something that is out of control? Especially when it's drugs, and especially when it's doctors. It's always doctors, it's never any other type of prescriber. You control dangerous drugs and you control irresponsible doctors. So this first one, the control dangerous drugs, this is from the announcement that they did. So a high potency opioid narcotics, as high potency opioid narcotics carry significant health and safety risks. Standards are required to protect Albertans with opioid addiction, receiving these highly specialized services and support evidence-based recovery-oriented care. And then related to control the irresponsible doctors, this is recommendation number 2 from the final report, that the government allow for supply replacement in the context of a treatment plan under the strict in-clinic medical supervision. So controlling the dangerous drugs, that was actually put into the Mental Health Services Protection Regulation. The actual name of the standards is the Community Protection and Opioid Stewardship Standards. Should anyone ever want to look those up? Sure. And again, this is all centered around physicians. Nurse practitioners are eliminated. And it looks at, again, controlling the idea that that it is the opioids that are dangerous and that must be tightly controlled. So I just want to, again, we talked about how this doesn't make evidence-based sense, but it makes maybe narrative-based sense. And I just want to help maybe reframe that for a second. So if we accept the framing that Alberta Health Services, like our health authority, yeah, perfect. If we accept that Alberta Health Services, the health authority in Alberta, is the only competent place to care for those with severe opioid use disorder, while also preventing the diversion of hydromorphone, high potency narcotics, to communities. And if we agree that high potency narcotics are the issue, again, we're accepting all of this framing, and that causes addiction in communities, the solution will be to tightly control their use, make sure there's absolutely no diversion, introduce as few people as possible to this dangerous substance. And if people are exposed to this extremely dangerous substance, we want to limit their time on that as little as possible. And so these are some of the details from that, from those standards. So all dosing is witnessed, because again, we cannot risk it getting out into the communities. And within those standards, we have to refrain from prescribing fentanyl whenever possible, because again, it's very, very dangerous. And as soon as somebody is started on these high potency narcotics like hydromorphone, we must make best efforts to transition somebody onto opiate agonist treatment as soon as is appropriate, when it should be open-ended treatment. So again, this makes narrative sense if you follow all of that storytelling through. And again, just to reiterate, because I feel as if people still don't, people can struggle with this because it doesn't make evidence-based sense, but it does make narrative-based sense. But regardless, this is mandatory. our licenses are held to this, and it is provincially mandated that this must be followed. Within the regulations, it is like a $10,000 a day fine if somebody prescribes and if a pharmacy dispenses outside of these regulations.
So where are we now with the NTS and everything that's been going on? So following the release of these regulations in 2022, a lot of us were really concerned. There were letters from the community of practice, lots of meetings, media, meetings with our regulatory bodies, and a court challenge. And the court challenge so far is really the only element that's really had success in protecting people on prescribed safe supply. So you'll see here a Calgary woman seeking a narrow individual exemption with the support of her legal team. And I wanted to share one of the rulings. So luckily she was granted an injunction. So there's one person in the province right now outside of the NTS clinic system who has access to safe supply. And this is outlined in the ruling from this decision in 2023. The evidence at this stage of the litigation shows that Ms. Black, who's the patient in question here, has a strong position that her constitutional rights have been infringed, that she will suffer irreparable harm, and it's clear that the balance of convenience weighs in her favor. I'm satisfied that this is an appropriate case in which to grant an injunction. So again, recognizing that this does impact her rights to access medication. Unfortunately, we're not really able to speak to widespread outcomes of the policy change. There's no official tracking going on that we're aware of. It was estimated around 350 people were impacted by what ended up essentially as forced deprescribing, and most of their stories aren't going to be told publicly. But we can use what we know about forced deprescribing and one person's story from getting her injunction for Ms. Black to draw our own conclusions about what has happened to the remaining 349 people who did not have an injunction. And there are some people who were able to transition into the NTS clinic environment, but many more who were not.
And we also, this is an opinion piece that was written by myself and Heather Morris. We're both members of ANCHOR, which is Alberta Nurses Coalition for Harm Reduction. Within our organization, we work with a lot of nurses who were witnessing this deprescribing that was happening, and experiencing significant moral distress as a result of that. And we wanted to draw public attention to this because when this was happening in Alberta, there wasn't a lot of public knowledge about these occurrences and about the harm that was being done. And we were hearing about this in the meetings from folks. And so as representatives of that organization, we wanted to write about that. So some quotes from that opinion piece. So we are witnessing a decline in patients' health status, their personal goals, and their hope for the future as people. They're being forced onto treatment because people were being forced onto opioid agonist treatment that had already been proven ineffective for them. And people were fearing for their health and their safety, and the moral distress that we were seeing and was astronomical, as well as the feelings of despair.
So what happens next? In terms of take-home messages, and we do have a few slides following this, what we really wanted to share was that, we know that narratives, these stories that are told by institutions, can make uncertain circumstances amenable to policy intervention. But those involved in making these policies can manipulate those narratives for their own political advantage. So if there are problematic elements in these narratives, if they're not corrected, if they're not addressed early on, they can really facilitate political manipulation. And we saw that in the way that this select special committee laid out who were the victims, who were the villains, and who were the heroes, and used this narrative to come to an obvious conclusion that we needed something like NTS in place to keep everybody safe. So the select special committee to examine safe supply really furthered that narrative around safe supply as the cause of helplessness and loss of control within the province. And so that narrative supported changes that were made to the Mental Health Services Protection Regulation and the introduction of NTS as clearly the solution to control prescribers and to protect Albertans. And we threw this in this morning because, you know, I think we're seeing a lot of parallels just this week in Alberta. Danielle Smith announced plans for a policy that bans all children under 17 from having top and bottom surgery, that teenagers need parental permission to start any kind of hormone therapy, and that they require a physician and a psychologist, and that Alberta parents will have to give permission before a student aged 15 and under can use a name or pronoun at school other than what they were given at birth. So, you know, we see the government using this narrative to control physicians, prescribers, nurse practitioners, and to make us, you know, to sort of weaponize us to carry out their own political agendas. And we saw it happen with NTS, saying it's actually illegal now to prescribe certain medications to a certain group of people. And we're seeing this, you know, likely happening again, where there may be policy coming shortly that says now it's illegal for prescribers to provide, again, certain medications to a certain group of people. So when we have this particular narrative framework, it really does allow the government, through controlling prescribing, to have huge influence on the lives of folks within these groups. And we can potentially guess what might be coming next down the line, and it's not a great feeling.
Yeah. So we didn't want to just end on a low note, not only because that is not the greatest way to end a lunch hour, but also because despite all of this, despite everything that has happened, and as doom and gloom as it can be, we were sort of reflecting on neither Kate nor myself are from Alberta, and like I can speak for myself. I moved here when it was not the UCP in power, and they were not a majority government, and I have continued to be here. I have my license in 2 other provinces apart from this one. I could leave, and I still choose to be here. And I have had to make some of the hardest choices in my career since they have come into power. And while I will never say that I am grateful, that will never be a thing that comes out of my mouth, it has been very clarifying, because I now know what my values are. I have had to stare them down and know certainly what they are and stand firmly in them. And I have also found like good people who have the same values that I have, and we have figured out how to push back and absolutely galvanize and get together and figure out how to push back against a provincial government. You know, Alberta, despite the fact that they have despite the fact that they have tried to put into law that nobody should be on safe supply. We have somebody on safe supply in this province, and that shouldn't be a thing that we should be allowed to have, and yet we do. As another example, IOT in 2021 was meant to close. We were not meant to have any more IOTs, and yet 2 remained open. This is also a place that, you know, without a doubt, if certain people had magic wands, there would be no more safe consumption sites. And yes, we've had to fight like tooth and nail to keep the ones we have open and where they are, and definitely some have closed. And I'm not saying any of those deaths are not completely tragic and awful and violent, but we have safe consumption sites open. We have one in a hospital open, and it's just like phenomenal that the gains that we have and the ground that we've held is phenomenal. And there are people, good people, who are still staying here. And if you're feeling hopeless because of stuff that is going on in where you are too. You have people like this in your place too. So where are those folks that you can also get together with and also push back in really important, meaningful ways too, because you have them there too.
Yeah, there are allies, right? We have community, and that's part of why this community of practice has been so essential, honestly, because we do need to lean on each other. We need those relationships. We need that trust. That's how we continue to show up every day and continue to fight for what we know, is right, and to fight for our communities, our patients, our friends, our families. So, you know, we're still here and still fighting, and very grateful for the support that we've had from folks within this community and throughout the country. So we're going to end there and leave some time for some questions and discussion, and thank you all so much for your time.
Amazing. Thank you so much, Patty and Kate. Yeah, I'm really grateful that there are people like you out there doing this work and sharing this with us. And I remember I was talking before about how it really is an opportunity for us outside of Alberta to really listen and hear what's happened there and your analysis of how it's come to be, so that we can be paying attention to what's happening within our own cities, within our own provinces, and then also across Canada. What narratives are being told, what problem is being identified as the problem, because how we define a problem is how we determine solutions. And who are the victims, who are the heroes, help us figure out who we're going to turn to, and how we're going to approach it. So I think that's a really valuable tool. And I do fear for the slippery slope, coming after people who use drugs, and telling prescribers, healthcare providers, how they can provide treatment. Starting there, my mind goes to abortion as well, and it's to me, we need to be paying attention, and even if it's an issue that doesn't touch, someone personally, to be able to see that slippery slope and where that can go. But when we're looking at the rates of drug toxicity deaths right now, it's hard to believe that not everyone's life has been touched by a loss or harm to someone that they know and care about. We're going to just do a really quick poll. If everyone would take a second to answer this poll, it's really helpful for us. We're fighting right now to try to secure some funding and finding out who comes to these polls, or to these webinars, and where you come from, and how useful these webinars are to you is helpful for us to help secure funding. So thank you for that. Also, please put your questions in, take a moment to put questions in the question and answer box, and let's go to some here. There's already a few waiting for us, Patty and Kate. So one question someone's asking about is the nuance between safe supply and IOT. Would the current government in Alberta identify IOT as safe supply, or is it seen as treatment?
Oh, this is like,
You can go ahead. Yeah.
yeah, let me just, oh, okay, you're unmuted. Okay. Yeah, this is, so like the NTS clinics, my understanding, I don't work at any of them. But my understanding is that the NTS clinics, they do include IOT within this, is that, so IV hydromorphone can be given at the NTS clinics. So it's sort of considered one and the same, because it's all witnessed. So it could be hydromorphone tablets, or it could be IV hydromorphone as well, which is, IOT.
Thank you. Just looking through the questions here. There's a few questions relating to the legal case of Ophelia Black's case, and there's questions asking about how can we support legal challenges, including things like where can we donate to? Just looking through. Yeah, is there a legal fund, class action, or public representation available for others? Have you heard of any kind of class action, sort of larger scale action happening? No.
No. No, nothing, as far as I'm aware, there's nothing larger in the works in that regard, at least not here.
Okay. Questions here about legal resources, potential class action. Just moving through your questions, folks. Are the physicians testifying against Safe Supply required to disclose financial conflicts of interest? Many own oat clinics and urine drug testing companies that would lose money from Safe Supply and divert people on Safe Supply to their clinics so they can make more money.
So when we were analyzing the transcripts, I didn't see any disclosure, to my knowledge. I don't know if that was done elsewhere, but in analyzing the transcripts, we didn't see anything.
Thank you. Great presentation. I'm Director of Policy at Canadian Public Health Association, working on a new CPHA position statement in favor of safer supply. Any key recommendations you'd recommend based on the Alberta experience?
A few.
Yeah. I don't even know where to start.
Yeah.
We'd be more than happy to connect offline if that's helpful. There's a lot to talk about, and there's obviously only so much that we could cover in a 1 hour in a 1 hour talk. But we have tried sort of different strategies since this happened and prior, with varying degrees of success and response. But again, happy to talk about that.
Yeah, we know also what to do, not just what not to do.
Yeah, that's great. So I've just sent the person saying email me and I'll connect you.
Great, thank you.
Okay, is the Alberta government requiring evidence-based strategies, accreditation, and standard for all these treatment centers they're supposedly going to open and publicly fund?
No, there's no regulations for treatment centers. That's an ongoing issue. That they've been trying to get that in place. In 2018, I believe it was the NDP who tried to start regulating. But then the UCP was elected in 2019, and that work has been stalled since then.
Thank you.
Yeah, there's not really transparency about where the money is going, what it's for, what the definition of a treatment bed is. So it is quite complicated to even try to navigate government announcements and understand what's actually being done.
What outcomes they're measuring, yeah.
Extremely depressing is a comment from one of our viewers. Other than one person who was granted an injunction, oh, sorry, this is another question about the challenge. Is there plans for a broader court challenge?
Yeah, there will be a trial at some point.
Yeah, so an injunction.
Yeah,
correct.
And so, do you know? Is there a way of supporting Ophelia's?
I saw. I do believe there was a link that was posted in the chat. I saw it pop up a second ago. I think I saw it was Petra that was posting it.
Great, thanks, Petra. And actually, Petra's also asking. You referred already to this a little bit, the announcements yesterday, and we're seeing in the news today about the legislation to prohibit gender affirming prescription in youth. And what do you think is the role of physicians and their regulatory bodies in regard to these changes?
Yeah, this is something we've discussed a lot. Again, not just not just physicians, but medical regulatory bodies in general. I think this is not, this is now becoming kind of a pattern of a little bit of a playbook in the province where we can shape a narrative in this way. If the physicians and the medications are seen as the problem, then regulations to control them are the solution. And I think, as we've heard, I think, you know, a lot of us are concerned about reproductive health down the line. Like, you can sort of see, as long as they continue to have success with this strategy, that there will be implications moving forward. So a lot of us with this announcement in the last couple days are already working on letters and reaching out to people that we know within the Alberta Medical Association, within other bodies, to say, you know, this is something we really need to take seriously. This is a huge overstep in government, telling us now what we can and can't prescribe within the evidence-based physician-patient relationship. So I do think we need more explicit, more explicit support from our regulatory bodies to say that this is not something that can continue to happen.
Yeah, I mean, we're meant to have licenses to uphold like standards and to uphold quality. They're not meant to limit. And what they're being used for now is to limit our ability to provide safe care, and that's not like our professional licenses are meant to provide so that we can provide safe care, and right now they're being used to shackle care, which is not how they're meant to be used at all. I think, you know, with regards to safer supply, obviously we need all compassion clubs as well. That would be a very easy win, so that for those of us who have licenses, that would then still provide access, right? We wouldn't have people in Alberta who died if we had compassion clubs.
We're just looking at the data on death rates. Yesterday, we were going through and seeing, like a 18% increase in deaths. It's a scary number.
And the governments are, the government is putting in these regulations that says, we can no longer prescribe this medication. But then it is individual prescribers who are the people now sitting down in front of patients and saying, I can't give you this anymore. So we really are being, it's beyond sort of this theoretical, oh, they can't tell us what to do. You actually are the one who has to now talk to your patient about not having access to that anymore, which is horrible, and something that that will continue to happen, I think.
Last question here: is there a publication of this analysis? Forgive me if you've already addressed this.
In process.
Yeah.
Working on it.
That's great. And you'll make sure we have it so we can put it up on our website, because we'll still have our website up and going. We don't have our whole team. And any last minute, there's one final question. As people who are not necessarily in positions of power, authority in government or healthcare, what are some ways that we can help advocate? I think your comment about find your people is a good place to start. Do you want to, any last thoughts around how we can advocate?
Yeah, I mean, I think that's it really, is finding your community and supporting each other. I think as soon as we start to pay attention to the narrative, then we can be more, we could be a little bit more deliberate in how we communicate with people in our lives. So having those conversations with people that can make a difference. And as a collective, we need to be thinking about the narrative. Stories have power, and hearing from other perspectives can make a difference.
Yeah, I will say, the more I find stuff like this, people are sometimes a bit nervous to speak up. I found when I started speaking up, like at work, on social media, people also found me, and that's then how I found more people. Sometimes it's very scary around this stuff to speak up, especially you're worried how you'll be perceived, how it'll impact your work. But it's more, it lets people know that you are a safe person, you care, you give a shit. And then people will find you, I found.
Thanks.
Mhm.
And I just see a comment in the chat here from Petra saying about find your people, form your arguments before this kind of legislation comes your way, be prepared. And
Yes,
often,
yes.
often in our work, we're all so busy dealing with a crisis or responding to this crisis that it's hard to lift our heads up and look ahead at what's coming, because we're so busy dealing with what's right in front of us. But we also need to have those opportunities to come together and reflect. So thank you so much for sharing your experience, for sharing this analysis, for doing this analysis so that we can learn from it and do the work we need to do to take care of our communities locally, but also, you know, regionally, but also across the country. We're in for a ride over the next while, I think. So we have to be together. So yeah, thank you so much.
Thank you.
Thank you.
And thanks to everyone who's come today. Yeah, we'll be sharing resources from this on our website. Thank you.